Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Thanks to modern medicine and advancements in healthcare, we are living longer than we ever have before in human history. But longer lives and medical breakthroughs do have their downfalls, including a new public health issue. Older Americans are contracting and spreading sexually transmitted diseases at record numbers. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. Today we focus on sex education and health. Stay tuned. Welcome back. Sexually transmitted diseases and HIV cases have increased at record numbers among older adults, according to the Centers for Disease Control and Prevention. Sexually transmitted diseases, or STDs, and HIV have serious health risks. I would like to welcome Dr. Sol Rivard from Pureview Health to the show this morning. Thanks for joining us.
Thanks so much for having me.
So we've talked a lot on our show about how important it is to be open and honest when talking about your health with your doctor. Do you think it helps to have just one primary care physician to kind of help open up that relationship, or what's your thoughts there?
I think that it's really important to have one primary care physician, and that's for a number of reasons. I think number one, it gives us a really clear insight into a person's overall health and well-being, and that longitudinal relationship is really important to be able to kind of guide you through certain conditions or management of diseases and see you through the different seasons of life. I think it's really important and neat that us as primary care physicians get to be with people throughout all stages of life. But really, whether you're seeing one doctor or many doctors, it's super important to be honest and open with your doctor. And that honesty really helps us to get a really intimate understanding of your health. And doctors like information, and the more information we have, the better we are to give you guidance and help treat some of your conditions or diseases. Of
course, perfect. So we're talking about sexually transmitted diseases today, which might be a little bit of a tricky topic. Somebody might feel embarrassed to bring up something like that. Any tips or advice on how to approach that conversation from the patient's perspective?
Yeah, people might feel embarrassed or hesitant to discuss their sexual health with their healthcare provider, but they really shouldn't feel ashamed at all. I think that one important and key points to make today, and especially for some of our rural viewers, is that anything that you say to your healthcare provider is strictly confidential, meaning it shouldn't leave that exam room when your visit is over. And you really shouldn't feel embarrassed at all talking to your healthcare provider about sex. One way to bring it up is to just say, hey, I'd like to talk about my sexual health today. So that's what I would recommend.
Okay. Is it helpful to prepare for that conversation ahead of time? How would you go about doing that?
I think being prepared to discuss the subject with your doctor is a really good idea. And my recommendation would be to bring it up right at the start of your visit. Not wait until the very last minute. And really the earlier you bring it up in the visit allows you more time to discuss that issue and ask any questions that may come up. And I would also urge people to make a list of questions that you might want to ask, because so often, anybody who goes to the doctor as they're walking back to their car after the exam, like, oh, I should have asked this one question. Bringing a list will help kind of make sure that you hit all the key points that you want to address.
That's great advice. Thank you for that. So what if someone just flat out does not feel comfortable talking to their provider, either about their sexual health or if they're concerned about an STD? What do they do?
Well, if a person doesn't want to be honest or open with their PCPs, they feel embarrassed or ashamed, they can always go to another doctor or another clinic. For whatever reason they feel more comfortable seeing somebody that they don't know, then that's a good option. But an important thing is if you do have an STD, or a condition, make sure that you tell your PCP. Like I said before, the more information we have, the better able we are to provide good health care.
Okay. So if an older patient, or any patient actually for that matter, is sexually active, what sort of information should they be sharing with their provider?
Well, if they suspect that they may have some sort of condition, telling your provider what sort of symptoms you're experiencing is always a good idea, and ask to be tested for STDs. Your provider will tell you which ones are appropriate to be tested for. Another key piece of information that's helpful for us is letting us know how many sexual partners you've had in the past 6 months, and what sort of protection measures you've used, if any, and how consistent you were with those protective measures is always helpful to help guide us again into providing good health care and checking STDs as necessary.
Okay, and so you mentioned the multiple partners. If someone is sexually active with more than one person, how often would you recommend they get screened?
Typically, I would recommend getting screened annually. However, I do say that with a little bit of caution, as some folks may feel a little bit more comfortable getting checked for STDs as they enter new relationships, in which case I think that's absolutely appropriate.
Okay. Are there, is an early diagnosis of an STD, can that save somebody from having long-term problems?
Absolutely. Many STDs, as we know, have long-term health care or health consequences. And it's so much easier to test and treat a condition earlier on. And this is certainly the same case with HIV. And it's also important to note that if somebody has multiple sexual partners, getting tested and treated for sexually transmitted diseases or infections can help to keep those from spreading to your partners.
Okay, so just one final question. We're about out of time here, but we mentioned at the start of the show that the rate of STDs among older adults, we're talking 45 and older, is on the rise. A thought or two on why you think that might be happening?
I think it's probably for a number of reasons. Number one, Americans are living longer now. And there are new medications out there like Viagra and hormone replacement therapy that are making sex possible. Another thought is, perhaps the older generations hadn't gotten quite the same safe sex messages that the younger generations had. Sure. So they might not be taking the necessary precautions to encourage safe sex and prevent infection.
Okay. All right, great. Thank you so much, Dr. Rivard.
Thank you.
We need to pause here for a break, but we'll be right back after these messages. Stay with us. Welcome back. We're talking to Shelley Mog from the Lewis and Clark County Health Department about the growing prevalence of STDs among older adults. Thanks for being on our show today, Shelley. Are sexually transmitted diseases, or STDs, only spread through sexual activity?
Well, majority of them are through sex, spread through sexual activity, but there are some that are spread through skin-to-skin contact, such as herpes and HPV, genital warts. They also can be spread through contaminated needles. So some of the same STDs that get spread through sex can be spread through contaminated needles, such as HIV and hepatitis B.
Okay. What are some of the more common STDs? What do those look like? What are some of the symptoms?
So the most common STD in America, plus in Montana, is chlamydia. Okay. And majority of people don't have symptoms. They have it and they don't know it and they spread it. But if left untreated, it can cause a lot of problems. But if symptoms do occur, it usually occurs, within a few weeks after exposure, and it can be, women can have a lot similar to a urinary tract infection. Burning with urination is probably one of the most common symptoms. Okay. And men, similar to burning when they urinate. Okay.
Let's talk about HPV. What is that, and is there a vaccination for that?
HPV is human papillomavirus. There is a vaccine for that. Human papillomavirus can cause cancers and can cause genital warts. So it's one of these that you can get and not know it if it's cancer. And of course, with genital warts, you can develop the warts. There is a vaccine for it. It's recommended for people from 11 years old to 26 years old. It's not really recommended for older people because the likelihood that they've already been exposed to HPV at that age, so it's not really recommended to protect them against it.
Okay, so there is a vaccination for HPV. How about other STDs? Are there vaccines for any others?
The only other STD that there's a vaccine for is hepatitis B, and so that is a 3-shot series that is routinely given to young, to toddlers, babies nowadays, but that does protect you against hepatitis B.
Okay, how does a doctor or another healthcare professional test for an STD?
There's lots of different ways. At the health department, we can test for chlamydia and gonorrhea just by a urine specimen.
Okay.
We get a specimen of urine, send it in, and that lets us know if they have chlamydia or gonorrhea. We also do rapid HIV testing, which is just a finger stick, drop of blood. Also, doctors' offices can draw blood to test for stuff like herpes, HIV, syphilis, and they can do swabs, which they would swab cervix of women. They can swab lesions, different tissues, throat, depending on where the infection could be.
Okay.
Could also do that. And then, so that's mainly how you get tested.
Okay, and are STDs treated? Can they be cured through medications, or how do you cure an STD?
STDs, bacterial STDs, such as chlamydia, gonorrhea, and syphilis, can be cured through antibiotics. And the viral STDs aren't really curable, but they're treatable. So for instance, HIV has a medication that can decrease the viral load and help you be less apt to spread it. Hep B does have a treatment out there. I'm not familiar with it. It is FDA approved, but I'm not familiar with that. And then herpes has medication that helps control the outbreaks.
Okay, so with viral STDs then, those can't necessarily be cured. So how does a person transmit that disease to other people?
So it can be spread through sex, oral, vaginal, or anal sex. It can be spread skin-to-skin contact. Typically when they're having symptoms, and sometimes when they're first exposed, they're more infectious. But for instance, herpes, if you're on a medication for herpes, then it may suppress, it may be less, you may be less infectious, let me put it that way.
Okay.
Or Hep B, for instance, if somebody's had the vaccine series for Hep B, they could be protected from getting the disease too. And Hep B also can be cleared from your system. Some people, their immune system works well and can clear it, so it wouldn't be infectious at that point.
Okay. If you do have a viral STD and you are infectious, is that something that lasts the rest of your life?
Yes, depending
Okay.
on if you cleared it, you wouldn't be infectious. But for the most part, herpes can last the rest of your life. HPV, you could spread that if you had that and didn't know it.
Okay. So we talked a little bit before the break about if you detect an STD early, that sort of puts off some of those long-term outcomes or consequences from STDs. Can you talk a little bit about what those might be? What happens if an STD goes untreated?
So there's different things. Chlamydia, STDs in general can cause, for women, pelvic inflammatory disease if left untreated, which is sometimes can cause scarring in your reproductive system, can cause chronic abdominal pain, infertility, etc. Syphilis can cause other problems, such as later in life, if you don't know you have syphilis and get it treated, it can cause some dementia, a lot of other problems and multi-organ systems in your body.
Okay.
So.
If you're treated for an STD, can you get it again, or does that prevent it?
Yes. So if you're, for instance, chlamydia, if you're treated with an antibiotic and you get exposed to chlamydia again, you can get it again. And then you take the same antibiotic again to cure it. Same with gonorrhea and syphilis. They can all be, and then there's different strains of HIV too, but yes, you can get it again.
Okay, so a treatment or a quote cure isn't going to prevent that in the future.
Correct.
Okay, so then you would have to go get the treatment again. Okay.
Yes.
All right, thank you very much. We need to pause for a quick break, but we'll continue this conversation after these messages. We're going to talk about HIV and how to prevent STDs. Stay with us. We'll be right back. Welcome back to Healthy Living for Life. According to the Centers for Disease Control and Prevention, or CDC, the number of older Americans living with the human immunodeficiency virus, commonly known as HIV, is growing. About 1 in every 4 people living with HIV is over the age of 50, and new cases among older adults are on the rise. We're talking with Shelley Mog from the Lewis and Clark County Health Department. Shelley, thanks for sticking around a little bit longer. So what is HIV? Can you talk about that a little bit?
So HIV is a virus that you can get through sex and through blood exposure, like through contaminated needles. And it attacks your immune system. So it just makes you not, in general, be able to fight infections. Your immune system becomes weak. You can get diseases easily that other people, necessarily diseases and cancers, except that other people normally wouldn't get if their immune system was working really well.
Okay, so you did already talk a little bit about how a person gets HIV, but I know that it used to be blood transfusions was a cause. Is that still a concern for folks?
They do screen blood. When you donate blood, they do screen the blood before they actually transmit it to other people, and they test it for many, many things. HIV is one.
Okay, great. And how does a person know if he or she might have HIV?
Some people may not have symptoms. They may have got exposed. And the other thing is if they do have symptoms, oftentimes it's like flu-like symptoms. So a healthy person gets exposed to HIV, they might have flu-like symptoms for a little while, not even think anything of it, feel better, and then go many, many years without even knowing that they have the disease.
Okay, wow. So how long can someone have HIV before then it progresses to AIDS?
So the progression to AIDS really varies. If somebody is on treatment, they may not progress to AIDS. It just really varies depending on your immune system, and everybody's different.
Okay, so we should probably take a step back and really quickly just explain what AIDS is when it comes to HIV and that whole transition.
So AIDS is the progression of the HIV infection, and so it's an active disease that really affects your immune system. And you can get pneumonias, you can get cancers, you can get a lot of illness, and often leads to death after you've been infected with the HIV virus.
Okay, so we've talked about several kinds of STDs and now about HIV and AIDS. Let's talk about protection. How can a person help make sure that he or she does not contract an STD or HIV?
That's a good question. So first thing is, of course, abstinence. But for most people they aren't abstinent, so the next thing would be to use condoms. Condoms don't protect against all STDs. We talked about the skin-to-skin contact diseases. So if, for instance, people have genital warts or a syphilis sore that is below the condom level, they could easily spread that, even with condoms. The other one is a monogamous relationship. So having a sex relationship with one person that person's also been tested for STDs, that's when you really know you're going to be protected.
Okay, and so you mentioned that condoms aren't 100% effective. It's probably also important to note that there are birth controls that don't do anything to protect against STDs. Can you talk about that a little bit?
Yeah, birth control in general doesn't protect you against STDs. Condoms prevent the semen, the fluids in the sex act to not get spread. So the pill, IUDs, all that does not protect you against STDs. And then condoms also have to be used correctly. You have to make sure they're not expired. So even if you do use a condom, make sure it doesn't tear. There's ways to make sure that you use it correctly.
Okay. We talked earlier in the show about how important it is to be open and honest with your doctor when bringing up sexual health, past partners, STDs. Can you talk a little bit about why it's important to be open and honest with your partner when it comes to those things?
Yeah. I think a good conversation really, number one is I tell people that protects them. If you can have a good conversation and talk about if you've ever had STDs, have they had STDs, how many partners have they had or have you had, what partners? Have you had sex with both genders, just one gender? Have you had sex, paid for sex? Those make people more at risk for STDs, and then that might allow you and your partner to know kind of where to go from there, and get tested before you start having sex is always an option also.
Okay, so you talked about some questions, so that's really helpful on having that honest conversation. What about if you've been diagnosed and have to go back and talk to people that you've had relationships with? How do you approach that? How do you have that conversation?
Yeah. You know, every relationship is different. Oftentimes, as part of the health department, STDs are reportable, most STDs, not all, but and we have to interview the case, the patient who has the disease, and we get partners, and part of our job is to anonymously, confidentially notify a partner that they've been exposed without sharing names. But some people choose to tell their partner. Okay. And so we kind of work with people on the best way to do that if they have an open relationship. And STDs, somebody can have an STD for a long time and not know it. So then you get diagnosed. It doesn't necessarily mean somebody in the relationship's been unfaithful. It just means that now we know we have this and we have to deal with this. So every relationship is a little different on how you handle it, but it is good to be open and honest. And like I said, we're trained in helping people kind of and notifying partners too.
Okay. And so you talked a little bit about what it is that you do when working with folks. Obviously, seeing a healthcare provider is going to be important, but are there other treatments, counseling, things that you would recommend for folks who learn that they have been diagnosed with an STD?
I think the biggest thing is, number one, you want the treatment. Number two is, the important thing is to protect your health and others' health. And so it's just important to do what you need to do to get your partners notified, and talk to your doctor. I mean, doctors that's what they're there for. It's confidential, it's private. When we talk to people, it's 100% confidential, and our goal is to educate and help prevent disease and help make you live healthier and better life.
Great, perfect. Shelley, thank you so much for bringing such an important topic to light with us today. Sure. And I would also like to thank Dr. Rivard for coming on our show too. We hope to see you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.